What we found is that, in patients who responded to immune checkpoint blockade, namely PD-1 therapy, they had a much higher diversity of bacteria within the gut microbiome, but no differences in the oral microbiome. And that was associated with differences in the tumor microenvironment. So they had an increase in immune cells within the tumor itself. And we also looked at differences in the composition of the microbiome. And we found that, again, responders to therapy had a completely different signature of bacteria within their gut, but no substantial differences in the oral microbiome. And what we found is that they had a higher abundance of bacteria that belonged to Clostridiales, whereas non-responders had a higher abundance of bacteria belonging to the Bacteroides. Specifically, we looked at several bacteria that were enriched, including Clostridiales and also Ruminococcus and Faecalibacteria. These were all enriched in the responders. And then what we did is we looked at the tumor infiltrates and compared what we saw in the gut of patients with what we saw in the tumor, and we found a very strong correlation between, the good or the favorable microbiome in patients with the favorable immune signature within the tumor. We also found that both the diversity and the composition was associated with a prolonged progression-free survival. Namely, if patients have a more favorable gut microbiome with a higher diversity and higher abundance of Faecalibacteria, then they have a significantly prolonged progression-free survival over those patients who don't. And that was an independent prognostic variable.